For now, I'd like to introduce our first keynote speaker for the conference, Dr. John Clapp, who will be speaking about the future of addiction science, opportunities for social work. Dr. Clapp is the Executive Vice Dean and Professor at the USC Suzanne Dworak-Peck School of Social Work and an international expert in the field of alcohol problem prevention. He's a Fellow of the American Academy of Health Behavior and co-director of the USC Institute for Addiction Science. Welcome, Dr. Clapp.
Good morning, everyone. I'm John Clapp, and I'm here to talk to you today about the future of addiction science and opportunities for social work within addiction science. Glad to be here today. So what I'd like to start off with is a little bit of history about addiction science. Addiction science as a concept is actually a relatively new kind of phenomenon. We've had people studying addiction for a number of years. But it's traditionally been a mishmash of topics and disciplines working around specific issues. Those disciplines include social work, public health, medicine, pharmacy, psychology, sociology, all on the science side. And then you have law enforcement, criminal justice, psychiatry on the treatment side of things. But so there's been a number of different academic and professional disciplines looking at addiction, but never really in a framework that was coherent. That's starting to change now, and that's what I'd like to talk a little bit about today. The history of addiction science is really rooted in alcohol and drug research, and then following kind of substance abuse research, you'd have tobacco-related research, sexual addictions, food addictions, and eating disorders. There's people that study caffeine and gambling addiction. And most recently, there's a whole host of addiction studies around technology. And this would include things like social media addiction, gaming addiction, you name it, anything that's really related to a technological device, a phone, etc. So that's a whole new emerging area of addiction science. But traditionally, these concepts that we use in addiction science have come out of research conducted by social and health scientists on alcohol, drugs, and tobacco, and then extending out to these other topics. The theories that we use to explain addiction and addictive behaviors have largely been isolated within disciplines, which what that basically means is social workers would approach it one way, psychologists would approach it another way, pharmacologists would approach it another way, and so on. And so you never really had an integrated theory, so to speak, of addiction. So how is this changing? How is addiction science moving forward to become its own new field? And I'd like to use the USC Addiction Science Institute for Addiction Science as an example of that, and talk a little bit about that, and then move on to talk a little bit about how social work fits into all this. So a couple years ago, a colleague of mine in preventive medicine, Adam Leventhal, started the Institute for Addiction Science along with myself and a couple other researchers. It initially was a collaboration between preventive medicine, social work, and pharmacy. And we are still the kind of the prime players in that. However, right now, the people working on the Institute represent almost every college and school at USC. So we have psychologists, sociologists, anthropologists, psychiatrists, et cetera, working alongside public health folks and pharmacists and social workers to really come up with a comprehensive and integrated way of looking at addiction, creating an addiction science, if you will. Uh, Similar to the mission of academics at most universities and most certainly at USC, we are focusing on science, education, and service. On the science side, we're really working on integrated studies that look at addiction behavior from a holistic kind of perspective in a multidisciplinary, transdisciplinary perspective, where we're working together in groups of diverse scientists to really get at complex problems around addiction, both in terms of the etiology of addiction, why addiction occurs, and the prevention and treatment of addiction. We're also offering educational programs, and these are going to range from, kind of local programs here at USC designed for our own students, to community educational programs for the population in Los Angeles. And then we're going to eventually expand beyond that to professional education, including a master's degree of addiction science, which we're working on currently and hope to launch very soon. In addition to that, we offer service opportunities. We're specifically really hoping to have an impact on the Los Angeles community around addiction. But as the Institute grows, we're hoping to move on to impact the state, the country, and finally move on to a global stage to address addiction. We're really interested here in developing what's called a transdisciplinary approach. And another way that people talk about transdisciplinary approaches is this idea of cells to society. And basically that means if you think about how people engage in addiction and addictive behaviors, that they have factors within themselves, whether they're genetic or it's brain chemistry or neuro functioning and so on, kind of things down at the cellular level that impact that, all the way through their motivations and expectancies and psychological factors, their social network and peer influence, their family, all the way up to the community they live in and the laws and policies that govern the substances and things that people get addicted to. And so this comprehensive approach, the cells to society approach, really tries to look at that problem at each of those levels of abstraction to come up with both a cogent explanation of how things work and why they happen the way they happen, but to identify strategic places to actually intervene through treatment and prevention to alleviate some of the problems that are associated with addiction. Beyond the traditional partners that I mentioned earlier, this is some exciting work is being done now where we're engaging people that might normally not be engaged in our efforts. Specifically, we've been working with people in engineering and computer science to use some of the research technologies and methodologies that they use and apply them to addiction to be able to answer some of these more complex problems that relate to this kind of idea of cells to society. All right, so how does social work fit into all this? So I'll start off by saying social work has really had a long history in the field of substance abuse, okay, or alcohol and other drugs, both in terms of prevention and treatment. And there are a number of social work researchers around the country working on these sorts of problems. And to a lesser degree, you'll find some social work researchers working on eating disorders or food addiction, sexual addiction, and gambling. And there's actually a couple people right now working on technology related addiction. but social work has been a player in this for quite some time. It also remains one of the more stable employment opportunities for social workers. So if you're interested in working in the social work field, in working in some way with addiction, there's a number of different opportunities out there, ranging from primary prevention. Not uncommon to find social workers working at county public health departments, working on primary prevention programs or school systems, all the way through treatment centers and recovery prevention programs. So we really have the full gamut of employment opportunities in social work around addiction and addiction science related areas. Even if you're not necessarily interested in working in the addiction field per se, almost every problem that we deal with in social work is somehow impacted by addiction or addiction related issues. And so whether you want to work in child welfare or in aging or be a military social work, the types of things that we'll discover through our work at the Institute and our work on addiction science will hopefully inform practice in those areas as well as we move forward. So again, a lot of opportunities here to be involved, both as a student, as a researcher, as a practitioner in the field of addiction, if you're a social work trained professional. Okay, so what's our specific role in addiction science? One of the things that's really important as we think about this cells to society perspective is that we have been long a leader in the social ecological perspective. So social work tends to look at problems from a systems perspective or a social ecological perspective, biopsychosocial perspective. There's a lot of different ways we talk about this, but it's the idea that different levels of abstraction all work together to influence behavior. They create environments that create social social problems, and at the same time that you have to intervene on all those different levels somewhat strategically and purposefully to solve these more complex problems. So that kind of perspective that we have as social workers brings a lot to the table when we're talking about addiction science. The other piece that I think is going to be critical is that social workers have long been champions of disparities research in the alcohol and drug field. In other words, we've kind of carried the torch professionally, not exclusively, because people in public health are interested in this as well in other fields, but we've really kind of carried the torch as far as social justice goes as it's related to alcohol and drug issues. And as we move forward in a more complex and diverse society, this will become increasingly important. So, you know, the ecological approach, our commitment to social justice and diversity. And now you're starting to see, interestingly enough, that some of these new partnerships that I spoke of earlier, where we're using the combination of engineers and computer scientists working with social work researchers, have been facilitated by our approach being somewhat similar, at least conceptually, to the way engineers and computer scientists approach problems from this more complex systems perspective. Some examples of this are machine learning and treatment. We have people in the school that are, including myself and Jordan Davis, that are working on papers related to this and studies related to treatment outcomes, machine learning and substance abuse patterns. You have Eric Rice working on social networks and social dynamics around behavior among homeless youth. that crosses over into the addiction field, and some of the work I've done, and I'm going to show you in a minute, with engineers, we're looking at the system dynamics of alcohol and other drug problems. And so we've kind of carved out a unique place for ourselves where we come to the table with a long tradition of doing this, but are partnering with some non-traditional partners to really dig in and try to come up with creative solutions to problems that have been traditionally very hard to solve. So let's give an example, and this is an example from my own work. So I started looking at alcohol prevention at the event level. And basically what that means is we were interested in preventing the kinds of problems that happen when people are intoxicated. And this can range from drunk driving to assaults, to sexual assaults, to other accidents, falls, etc., fires. And that was the area I was interested in working. I've been working in that for a number of years. So a few years ago, we started working on the idea that you could use the principles used in computer science and engineering, along with existing social ecological theory and social work, and what was already out there in the evidence about what works, combine those in an integrated framework and come up with smart interventions. And when I'm talking about smart interventions, in this case, I'm actually talking about real-time interventions, or sometimes called just-in-time interventions, that are designed to intervene in real time during an event to bump people from a trajectory that might be problematic to a trajectory that is somewhat safer. Now, when I was working on this prior to working with the engineers, this was the basic model that I used. And you can kind of see the ecological levels here. We have person, environment, intoxication, proximal outcomes. And on the person level, you have behavioral outcomes or behavioral factors, psychological factors, demographic factors. We looked at some genetic factors earlier in my work. The environment, we're talking about the social attributes of an environment, the physical or built environment, et cetera. And then intoxication was measured through breathalyzers and self-reports. And then we had certain proximal outcomes that we were looking at, or acute outcomes, including DUI, violence, and sexual behavior. This model was useful, and we looked at this using traditional social science and social work methods, and wrote a number of papers and came up with some interventions and tested them, and they had some effect. But there was still this kind of challenge that they didn't really solve the problem at a level that was satisfactory from a number of perspectives. And so given that, I started working with a team of engineers, and this work started back 4 or 5 years ago when I was at Ohio State, and continued on to the present. And what I'm showing you here is basically one of the first mathematical models that the engineers and I came up with using some data that I'd collected in earlier studies back in San Diego. And we had data from 1,700 people who were intoxicated at bars or coming out of bars in San Diego. And we had information both on them and the group that they were with, their motivations for the night, etc. And we took a basic social psychology theory that I'm sure most of you've heard of, who've taken Psych 101, Lewin. And we took that data and we created a mathematical model and put my data into the mathematical model and ran some simulations. And basically what we were able to show was that even when people go out without the intent to become intoxicated, it only takes one influential individual to drag most of the other people off into heavier drinking. So this was an example of modeling the social environment. and figuring out that it's pretty important to pay attention to the peer network when you're trying to intervene in real time. I'll give you another example. One of the things that we were interested in were how people move across locations over the course of a drinking event. And so if you were studying young people, folks in the military, college students, young adults, it's not uncommon to find them maybe starting out in one context that's a private context. And in this case, we would have a party, the graphic showing, and they would move then, or some people would move from that party to a bar setting, and then from a bar setting to another bar setting. And with each one of those moves, a new level of risk is introduced. Okay, so as you move from a party to a bar and a bar to another bar, those transition points are risky. And as the graphic illustrates, the squares, I believe, were males in this example, the circles were females, and all those arrows pointing from circles to squares and so on are social influence. Again, taken from data that we had. This is actually called an agent-based model that I'm showing you. But you can see the shading in those squares and circles changes over time. And those represent the person's level of intoxication. And so this model helps look at potential places to intervene within the course of a drinking event, both in terms of time and space. So do you intervene early? Do you intervene with an individual? Do you intervene with a group of people? Do you target males? Do you target females? Do you try to target the transition points? So these are the types of things that we're studying here when we're trying to understand how better to spend limited prevention dollars when we're trying to prevent problems like drunk driving, sexual assault, violence that's related to alcohol and the like. Okay, so let me just take a couple more minutes here and talk about future directions. I think increasingly we're going to see more technology in prevention and treatment. And this is a bit ironic, as I talked about the problem we're having now with technological addiction. But technology in and of itself is neutral, and we can harness the power of technology to help prevent problems and help people maintain healthy kind of lifestyles while they're in treatment and post-treatment. So one of the things that you're starting to see is something called geofencing. And basically your phone, or most smartphones now have a GPS built into them, along with some mapping software. You can take information from the individual and you can enter it into an app and basically kind of steer them away from high probability environments that they might find themselves getting into trouble. So in other words, if a person that had a specific drug problem used to frequent certain areas to buy their substance of choice, you could geofence that area, and some prompt would go to the person and their sponsor that they were getting into dangerous territory. The other application of this might be a high density alcohol area. So you could put in all the alcohol licenses and outlets in one area. And if someone had an alcohol problem, it would be good to know that they're heading into a bar district, for instance. The other thing is this just-in-time intervention that I talked about. And what this will probably look like is where people will be prompted during certain drinking events to drink more water, to eat more food, to order an Uber. It'd be the kind of thing you'd opt into and subscribe to, where you wanted to make sure you kept yourself safe in certain situations. And so there's a number of people working on that type of an intervention right now around the country. But this is going to be one of the big areas that'll kind of, I think, emerge in the next 20 years in addiction science. And then the final piece that I think we'll see coming is Nano Telehealth, which is basically where you'll be able to get snippets of advice from a professional in real time via text or FaceTime. And there's other people out there working on this right now as well. So you're going to see more technology in treatment and prevention. I think you're going to also see more collaboration with stakeholders, and this is kind of another piece that is very consistent with social work's approach to problems, in that people are starting to realize, scientists are starting to realize, and policymakers are starting to realize that for you to have a successful intervention, you need the input, the buy-in, and really full and true collaboration with the people that live in the communities that are affected. So collaborative modeling is one of these techniques that is starting to emerge, where you work with stakeholders to both understand the causes of the problem and potential solutions to the problem. And by the time you're done with this process, you have an intervention that was co-created by everyone involved, experts, people that are impacted by the problem, and so on. And there's a much more buy-in into the final outcome and the final approach to preventing or solving the problem. And then I think we'll see more specialization. And so whether you're a social worker or a social worker or a nurse or a public health person, I think that there's going to be more and more opportunities out there to earn a degree or joint degree that in addiction science. There will be certificates for certain areas of addiction science practice, and so on. And I just think that the opportunities to learn about this will be much richer in the coming years. And with that, I'm going to close up here, and we'll go on to the next segment of today's event.
Thank you, Dr. John Clapp, for such a wonderful presentation. We will be taking a quick 5-minute break, and we will be back with our next keynote speaker. See you soon.